1027 and 1035 WICY, your feel-good favorites from the 80s and more. It's John Kazar, joined by Dr. Todd Whitman of the University of Vermont Health Network as we chat with him on Wednesdays, of course, to kind of get the scoop about things. And first of all, Todd, how have you been? It's been a few weeks.
I'm very well, thanks, John. I appreciate that. We've had a great weather, and we've been enjoying the summer with the kids, so it's been nice, despite all the social distancing.
Yeah, no, there's positives to look at through all this, I think, which is something we should all try to look for. But the Alice Center, we need to update, as we did here last week about an employee testing positive. What's the scoop on that?
Exactly. So the state still mandates that we do testing of all employees who are asymptomatic once a week. And last week we had our first positive of all the tests we've done for that. We're doing around 200 tests a week at this point. We were at 400 tests a week at one point. And the person who was positive was retested, remained asymptomatic, and the second test was negative. We tested all the residents and all of the employees at the Alice Center, and we were grateful to have negative results for everybody. So great news there. The team really pulled together and did testing very quickly, and the families were all great to give consent for all the residents. So it was a good show of how we can work together, and luckily all the results were negative.
Are you kidding me? I mean, I'm so surprised they're all negative. I mean, it's great. You think, you get worried when you hear about, one person around all those people. You think one would get it, but we're good to go, at least in this respect.
Exactly. And so, I think it just shows that we do have a low prevalence in the North Country, but we need to continue to be careful. There was a church down in Ticonderoga that I believe it was on Saturday. A person was at the 9 o'clock Mass, had an exposure, and now they're recircling with all those people to try and make sure that everybody gets tested and checks themselves for symptoms. So, we have to continue to be careful. I noticed my wife and I were in Lake George this weekend just driving through, and there were very few people with masks on, and I was concerned about that. In the North Country, it seems like people are much more attentive to wearing their masks and keeping their distance when they can't. And so I think we need to continue to do that for sure.
Oh, yeah. And speaking of the masks, there's been some misinformation about the cloth ones, or do you want to dive into that a little bit?
There has. There's lots of concerns that people have, and I think, like all issues that people don't like, there start to surface some maybe untruths. People talk about the cloth mask lowering oxygen intake levels, and that's just not true. If you're a healthy person, you should be able to breathe just fine with the masks on. There are people who have severe COPD or on oxygen or have other pulmonary conditions where it may make it slightly more difficult to breathe, but healthy people should have no difficulties. There's also issues about the masks capture carbon dioxide or that they grow bacteria. Everybody should be laundering their masks regularly, but they don't lead to carbon dioxide buildup or other problems. They don't suppress your immune system, which is another one of the rumors that's gone around. So in general, masks are safe. We need to wear them. Again, they're not PPE. They don't necessarily provide a great deal of protection for the person wearing them, but they certainly protect the people around you. So when you notice friends and family not wearing masks, just encourage them to do so to keep everybody safe.
Okay, will do. It's Dr. Todd Whitman with us from the Alice Hyde Medical Center, the University of Vermont Health Network, more largely, right, Todd?
Indeed, yes.
Yeah.
We're grateful to be part of the network.
We're grateful to have you every single week, giving us what is encouraging updates. Again, it was nice to see that there was no one that got that COVID that was exposed around that person. So, I guess we're doing our jobs, a lot of us.
I think all the things that we have in place are working well. And again, it's the community that really makes it work and keeps us safe because they're doing the right stuff.
As a whole, absolutely. All right, Todd, thank you so much for your time.
Sure, you have a great day, John.
All right, inside the community, it's 1027 and 1035 WICY.